Dereta, dereta, dereta. Stoppa, stoppa, stoppa. Muovere, muovere. Hop, 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 hop. Non muova. Ah, l'asparagus.
Hi, hello, my name is Stephanie. I'm a physician assistant student working alongside Dr. Gonzalez. Is it okay if I assess you today?
This is fine.
Okay. How may I address you? Anna or Miss Aguayo?
Anna is fine.
Okay. Okay, Anna, so I'm just going to ask you a few questions for today, okay? So primarily, what's the reason you're coming in for today?
I've been having this cough for about a week now.
Okay, can you tell me more about that?
Well, it just started about a week ago. I wasn't doing anything special. It just, just this cough that just doesn't go away.
Okay, so it started about a week ago. Okay. Is there, so it's been about a week since you've had it, right?
Mm-hmm.
So would you say it's a constant cough or intermittent? Like, is it constant when you're coughing? It comes and goes?
I feel like I have it all day.
Just all day? So it's a constant cough. Okay. And have you had this problem before?
No, never.
You haven't had this problem before? And would you say that you have pain whenever you're coughing?
Very slight pain because I've been coughing so much that I'm getting some irritation.
Okay, so just a very slight pain. Mm-hmm. And is anybody else around your house sick? Do you have any other sick like family members or anything like that?
No, not that I know of.
So just you with the cough.
Mm-hmm.
Okay. Well, I'm sorry to hear that. Are you having? You said you're not having pain when you cough, correct? Or
very slight discomfort.
Very slight, just excuse me, discomfort whenever you're coughing. Okay. And so on a pain scale of 1 to 10, 1 being no pain at all, and 10 being the worstest pain you've experienced in your life, what would you rate your pain?
Like a 1 to 2.
Just a 1, so it's more like an annoyance,
yeah.
Right? Okay. And is there anything that makes your cough worse?
If I'll do any sort of exercise, anything like that.
What about if you're in a certain area, like a certain environment that makes your cough worse?
Not that I've noticed, no.
No? Okay. So just wherever you are, would you say that's just you're just coughing, or? Okay. All right. What about anything that makes your cough better?
I've taken some over-the-counter cough suppressants.
Okay.
They help for a little bit, but then my cough comes back.
Okay. And what about any home remedies besides a cough suppressant? Is that the only thing you've taken?
I put some Vicks on my chest.
And did it work?
Oh, yeah.
A little bit? Okay. And is there any other symptoms you have associated with the cough?
No, that's it.
No symptoms? All right. So, I'm just going to go over everything you've told me just to make sure everything is correct. I'm sorry, I have one more question. Whenever you cough, is there a certain color to your sputum?
No, I don't have any. I'm not coughing anything up.
It's just dry. Like a dry cough, you would say. Okay. So just to go overall, make sure everything is correct. You said you've been having this cough for about a week. Was there anything you were doing when you had that cough, like when it started? Were you maybe outside or something like that? Do you remember?
I don't think I remember.
Okay.
It wasn't anything special.
Okay. So you said you've been having this cough for a week. You said that also nothing really aggravates it. You put some Vicks on and it didn't work. You also took some over-the-counter cough suppressant, and it worked for a little while, but then it didn't get any better. And also on a pain scale of 1 to 10, you have a pain scale of 1, and you said you're the only one that's sick in your family, right?
Mm-hmm.
All right. Well, I'm sorry to hear that. Did I miss any information or anything like that?
No.
No, everything was correct. Okay, so now I'm going to go over just your past medical history, okay?
Okay.
Just going to ask you some few questions.
All right.
So, primarily, do you have any allergies of any kind?
Yeah, I have seasonal allergies.
Seasonal allergies, okay. And any other allergies besides those, just seasonal allergies?
Penicillin.
Penicillin. And what type of allergic reaction do you get to the seasonal allergies?
I don't really know. My mom just always told me that as a little girl that I was allergic to penicillin. She said I got a rash, but I've never experienced it. I've experienced it, but I don't remember. I was too young.
Okay, so you get a rash for your seasonal allergies. I'm sorry, you said penicillin.
Penicillin.
And what about your seasonal allergies?
Oh, just runny nose, itchy eyes, scratchy throat.
Scratchy throat. Okay. And what about any illnesses that you've had in the past?
I had an issue with my left eye. They called it uveitis.
Mm-hmm. And when was this?
This was about 2 years ago.
2 years ago. And what was the outcome?
They just gave me some steroid eye drops and said that it was probably an autoimmune issue going on, so there wasn't really much that they did.
Okay. So what about any other illnesses besides that one?
No, that's it.
Okay. What about any hospitalizations that you've had?
No, I've never been
No
hospitalized.
hospitalizations. And surgeries that you've had?
No surgery.
No surgeries. What about any trauma, like any serious injuries you've had in the past?
I broke my wrist when I was in middle school.
Okay, in middle school. Okay, so, and what was the outcome for that? Did you have to have surgery or anything like that?
No, they just put a cast on me.
Just a cast?
Mhm.
Okay. And what about traveling? Have you traveled outside of the country in the past few months?
Yeah, I went to Mexico about 3 months ago
Okay, how long did you stay there for?
for a week.
And it was would you say it was like a vacation?
Mhm.
Okay, that's great. And now I'm just going to transition into asking you some questions. They may be a little sensitive, but I'm just asking them so I can provide you better care, okay?
Okay.
So I would just ask if you can be as honest with me as you can, possible.
Okay.
So primarily, are you taking any contraceptives?
No.
No? Okay. Have you been pregnant?
No.
Okay. And do you have any fertility problems or OB complications?
Not that I know of.
Okay. So now, thank you for providing me with that information. I'm just going to go over your vaccinations. Okay, are you up to date with all your vaccinations?
Mhm.
What about your yearly examinations?
Yeah.
Yeah, same with like your well woman's examination.
Oh, yes.
Okay, great. And what's been the result of them? Everything's been good?
Yeah.
Okay, great. So now I'm just going to go over your family history, okay? So when I talk about your family history, I'm going to be talking specifically or asking specifically about your parents. You say you don't have any children, so no children, about your parents and your siblings and also your grandparents, okay?
Okay.
Okay. Excuse me, I'm sorry. So primarily, would you say that, are there any conditions, genetic conditions that run in your family?
Probably diabetes.
Diabetes? Okay. What about any other conditions besides diabetes?
No, that's the only one I can think of.
Okay. And then diabetes, is that from your parents, parents' side, grandparents?
My mom's side of the family, so my mom and her mother and her sisters.
Okay. And what is the outcome for them? Do they have it controlled or?
Some of them, not all of them.
Okay. So diabetes on your mom's side.
Mhm.
Okay. So just diabetes. What about any pregnancy-related issues?
No, not that I know of.
Or psychiatric diseases?
No.
Any drug or alcohol dependence?
My father is an alcoholic.
Okay. And what about any toxic exposure?
No, nothing.
No? Okay. Well, excuse me. Thank you for allowing me to get this information from you and for being very honest with me. So now I'm just going to go over your social history, okay?
Okay.
Thank you.